बिस्मिल्लाहिर्रहमानिर्रहीम। मेरा नाम डॉक्टर मोहम्मद उस्मान शेख है। I welcome you all on the behalf of Amigo. First of all, before I start on to the assigned topic by the Famigo, मैं ये दुआ करता हूँ कि हम सब खैर आफियत से होंगे और इस बाबरकत महीने की लास्ट डेज़ के से दिल से दुआ है कि हमें इस वबाई निजात मिले जल्द से जल्द। आमीन सुम्मा आमीन। Now, today's our topic of discussion is iron deficiency anemia, a public health perspective. I'm pretty much sure that everybody must be very well aware what exactly the iron deficiency anemia is. Today, we are going to touch the main practical points as far as this topic is concerned and the awareness among our public health workers. What is anemia? Anemia is a condition in which you lack enough healthy red blood cells to carry adequate oxygen to your body's tissues. As far as the normal ranges are concerned, according to the age, newborns 17 to 22 grams per deciliter. Right after the 1 week, it goes down up to 15 to 20 grams per deciliter. And at the age of 1 month, 30 days of age, it goes to 11 to 15 grams per deciliter. So it shows जब बच्चा पैदा होता है तो उस पैदाइश के ऊपर जो हीमोग्लोबिन का लेवल है वो ज़्यादा होगा as compared to at the age of 1 month. Later on, the children average age should be from 11 to 13 grams per deciliter. This is the normal range as far as the hemoglobin is concerned. And when we talk about the adult males and females, there's a difference of 2 grams, which we usually consider. In adult males, that is 14 to 18 grams per deciliter, whereas in adult females, that is 12 to 16 grams per deciliter. When we talk about the men after middle age, that is 60 to 65 years of age and above, that goes down, that goes up to 12.4 to 14.9 grams per deciliter. Remember this thing that it is going to be reduced after 60 or 65. So nothing to worry if you come up with the report with the hemoglobin levels up to 12.5 or 13 even. So that will be a normal one. Same case with the women after middle age, that is 11.7 to 13.8 grams per deciliter. These are the normal ranges which we all should aware of. What are the different types of anemia? Aplastic anemia, iron deficiency anemia, sickle cell anemia, thalassemia, very common in Pakistan, hot burning topic nowadays, especially vitamin deficiency anemias. So as far as our today's topic, which is the iron deficiency anemia, this is a disease of every age group. कोई एज ऐसी नहीं है जिसके अंदर हम ये नहीं कह सकते कि आयरन डेफिशिएंसी एनीमिया इस एज ग्रुप में नहीं हो सकता. It is the most common type of anemia and it occurs when your body does not have enough of the mineral iron. Your body needs iron to make hemoglobin. When there is not enough iron in your bloodstream, the rest of your body cannot get the amount of oxygen it needs. Okay, iron ने ही ultimately oxygen carry करवानी है. As far as epidemiology is concerned, UNICEF's report says more than 2 billion individuals have anemia worldwide, huge number, and most of them have iron deficiency anemia, especially in underdeveloped and developing countries like Pakistan, Bangladesh, India, etc., where 40 to 50% of the children are iron deficient, compared with 6 to 20% in developed countries. So huge, remarkable difference as far as the developing and the developed countries are concerned. But still, as far as the anemias are concerned, iron deficiency anemia prevails and it comes at the top. Recent statistics shows a prevalence of around 45% of iron deficiency anemia in Pakistan, which is quite high, realizing the failure of public health measures to control it. शायद हम लोगों ने इसके बारे में बहुत कम बात की, बहुत सोच कम कहा, बहुत कम काम किया. यही वजह है कि इसकी इस वक्त तादाद हमारे मुल्क में काफ़ी ज़्यादा. अकॉर्डिंग टू ईस्टर्न मेडिटेरियन रीजन ऑर्गेनाइजेशन EMRO WHO statistics, it has been found that more than one-fifth of women in Pakistan suffer from anemia. Every fourth child in Pakistan is suffering from iron deficiency anemia. According to the National Nutritional 2018 report, which surveyed 7,138 children aged between 6 and 9 months. And you can very well imagine कि एक में से हर 4 में से एक बच्चा जो है वो iron deficiency anemia में मुब्तला हो रहा है. Iron deficiency anemia was found in 33.2% children. It is common among Pakistanis and leading cause of morbidity. Definitely अभी हम आगे कुछ स्लाइड्स में पढ़ेंगे morbidity किस तरीके से बढ़ती है because of this deficiency. 4 में से एक, I found it very interesting. पाकिस्तानी बच्चा आयरन की कमी का शिकार है. अपने बच्चों को 6 माह की उम्र से आयरन से भरपूर ग़िज़ा दीजिए. ये जो 6 माह का वर्ड है, we will be discussing later why it is so important. Excuse me. Causes of iron deficiency. They could be physiological or pathological. When we talk about the physiological reasons, increased demand comes at the top. Infancy है, बच्चा develop हो रहा, rapid growth, pregnancy, women needs more iron because the baby is developing in the womb. Menstrual blood loss, natural reason. When we talk about the environmental physiological reasons, insufficient intake, for example, a person is not found to eat meat, गोश्त नहीं खाता, सिर्फ होली सोली वेजिटेरियन डाइट पे है. एंड लॉट ऑफ इंडियंस हैव दिस इशू, जो स्ट्रिक्ट वेजिटेरियन डाइट्स में. नाउ कम अप विद द पैथोलॉजिकल कॉजेस. डिक्रीज एब्जॉर्प्शन, एब्जॉर्ब ही नहीं हो पा रहा गट से. गैस्ट्रेक्टमी हुई भी है किसी भी रीज़न की वजह से. ड्यूडेनल बाईपास हुआ है. क्रोहन्स डिजीज़ है उसको. क्रॉनिक एज फार एज द डिजीज आर कंसर्न, गैस्ट्रोइंटेस्टाइनल tract diseases like peptic ulcer are very much common, prevail karta hai in this society especially. Many reasons: colorectal carcinoma, angiodysplasia, systemic bleedings, post-operative recent trauma. These are the pathological chronic blood loss. When we talk about the decreased absorption and the blood loss, very common, very important, which should not be unrecognized. जिसको दिमाग नहीं देखता उसको आंखें नहीं देखती. So we should remember this thing, that hookworm infestation is the most important cause of iron deficiency anemia in our society. And imagine 0.25 milliliter of the blood loss per woman per day, per worm per day. Now you can very well imagine कोई एक worm तो नहीं होगा उस गट में, और वो एक वर्म से बहुत ज़्यादा वर्म्स होंगे. सो यू कैन वेरी वेल इमेजिन द ब्लड लॉस. अच्छा, इसमें अगर आप गौर करें, डिक्रीज एब्जॉर्प्शन ब्लड लॉस इसलिए लिखा है, एक कोगुलेज फैक्टर आता है जिसकी वजह से ब्लड लॉस होता है. एक तो ये खुद खाता भी है, एब्जॉर्ब नहीं होने देता और ज़ाया होने देता है, जो स्टूल में फिर ब्लड निकलता चला जाता है. व्हेन वी टॉक अबाउट द ड्रग रिलेटेड इश्यूज, एंसर्स वेरी कॉमन, सेल्फ प्रिस्क्रिप्शन, खुद ही से जाके पॉन्स्टॉप, खुद ही से जाके ब्रूफिन, खुद ही से जाके नेप्रोक्सन सोडियम वगैरह लेना, हमारे अंदर ये बहुत प्रिवेल करता है. पर्सन हु आर ऑन स्टीरॉइड, ग्लूकोकॉर्टिकॉइड्स हैं. फिर वो लोग, मेरा मैदा ख़राब है, मैं ये राइजिक का कैप्सूल या किसी एक ओमेप्राजोल या इसोमेप्राजोल, जो चीज़ें हम अक्सर सेल्फ मेडिकेशन करते चले जाते हैं. या अगर एक फॉर एग्जांपल किसी डॉक्टर ने लिख दिया है, उसको एक दफ़ा लिखा है 6-7 दिनों के लिए, वो लेता चला जाता है, 2-3 माह कंटिन्यूसली ले रहा है. सो अगेन प्रोटॉन पंप इनहिबिटर्स का excessive usage can really lead to iron deficiency anemia as well. And last but not least, the genetic, the iron refractory iron deficiency anemia is another cause as far as iron deficiency anemia is concerned. Bleeding is the most common cause of iron deficiency, no doubt about it, either from parasitic infestation, like I said earlier, hookworm infestation, or other causes of the blood loss, कोई trauma हो गया है, recent surgery हुई है. In men and post menopausal women, iron deficiency usually indicates bleeding in the digestive tract. मेंसेस नहीं आ रहे खातून को, या वो कैटेगरी जो आदमी है, उनके अंदर iron deficiency anemia, always think about anything going bad with the GIAT. Whereas in premenopausal women, menstrual bleeding is the most common cause of iron deficiency anemia. This is a classical diagram of hookworm infestation. किस तरीके से जाता है. Remember one thing, the people who works in the fields, उनमें ये बहुत कॉमन है. बच्चे barefoot अगर बाहर खेलते हैं पार्क्स वगैरह में, again very much common. फिर uncooked food अगर हम properly cook नहीं किया हुआ, again we will be having this infection. So we should be careful about this as well. So deworm करना हमारे लिए बहुत ज़्यादा important as of the public health perspective. Clinical features of iron deficiency anemia. As the slide clearly shows, quite a lot of features which a person can have. But remember one thing, all these features come with the passage of time. Acute इनमें से कोई feature नहीं होता, क्योंकि iron deficiency होने में भी time लगता है, इसीलिए इनके जो signs and symptoms भी होते हैं उनको develop होने में definitely उसी तरीके से time ज़्यादा लगेगा. So whenever we look around and we found a person coming up with the general weakness, dizziness, lightheadedness, extreme fatigue, rapid heartbeat, easily broken and brittle nails, paler than the normal skin, खून ज़्यादा जो है रंगत गोरे की तरफ जा रही है, वो असल में गोरा नहीं हो रहा होता, वो खून की कमी हो रही होती है. Chest pain, ऑक्सीजन नहीं मिल रही coronary vessels को because of the lack of hemoglobin due to the lack of iron. Headaches, cold hands and feet, soreness or inflammation of the tongue, craving for non-nutritive things such as dirt. For example, अब ये अक्सर माएँ हमें आकर कंप्लेन करती हैं कि हमारा बच्चा स्क्रैपिंग्स खा रहा है वॉल्स की, डर्ट खा रहा है बाहर से. तो इनको आपने गौर से देखना है कि ये एक निशानी हो सकती है वर्म इन्फेस्टेशन की भी. फिर उसके अलावा बहुत कॉमन poor appetite, especially in children. How can we neglect that part as well? So these are the common clinical features which we can come across. When we talk about the complications of these, possible complications include slow growth and developmental delays in children and infants. Heart problems, including heart failure or an enlarged heart due to its compensating for lack of oxygen. Pregnancy complications, including low birth weights and increased risk for premature birth. So these are the most important complications due to the iron deficiency anemia. Beautiful pictorial representation of effects of iron deficiency anemia in kids. So ultimately, that will lead to growth retardation. When we talk about the management always starts from history. Diagnosis will be based on medical history and physical examination and the results from the test and procedures. Medical history always asks about any visible blood loss from any part of the body. Ask about the breathlessness on exertion, very common feature. Inquire about the diet and any medication like NSAID history, like vegetarian diet, strict vegetarian diet, etc. Confirm about the menorrhagia or pregnancy in a female patient. Also inquire about the occupation. When, like I said earlier, especially the person who is working in the fields, farmers हैं, उनमें worm infestations होने के chances ज़्यादा होंगे. If children ask about the habit of eating of wall and soil scrapings, we have already discussed about it as well. So we have to, again I will repeat my phrase, जिसको दिमाग नहीं देखता उसको आंखें नहीं देखती, because if we will be knowing all these things, then we will be able to ask these questions from the patient or patient's attendant. When we talk about the physical examination, look at the skin, लोअर कंजक्टिवा आपने देखना है, अगर वो पेल है उस साइन को पिक करना है, गम्स देखने हैं, palmar creases देखनी है, nails देखने हैं, nail beds to see whether they are pale or not. Listen to the heart and the heart sounds, very important. Palpate the abdomen to check the size of your liver and spleen. खुदा ना खासा splenomegaly तो नहीं हो रही है. Do a pelvic and rectal examination to check for internal bleeding as well. As far as blood tests are concerned, CBC, complete blood count. Complete blood count, what we have to look for, definitely hemoglobin, no doubt about it, whether it is within the normal range or not. Along with the hemoglobin, we will be looking for mean corpuscle volume, MCV. Mean corpuscle volume, hemoglobin concentration, or MCHC, mean corpuscle hemoglobin concentration or mean corpuscle volume, have values below the normal range for the laboratory performing the test. Reference for MCV, MCH are 83 to 97 femtoliter MCV के लिए है और 32 to 36 grams per deciliter MCHC के लिए है. Or always remember, whenever MCV level will be lower, it will depict the size of the RBC. That will depict the size of the RBC will be smaller, means microcytic. And iron deficiency anemia is the one of the top leading cause as far as the microcytic anemia is concerned. Apart from CBC, within the CBC, we look for the hematocrit levels as well. This is the percentage of your blood volume made by the red blood cells. Normal levels are generally between 35.5 and 44.9% for adult women and 38.3 to 48.6% for adult men. These values may change depending on your age. This is the diagramatical microscopic picture of blood peripheral picture. You can very well differentiate between normal and the anemia one. With iron deficiency anemia, the red cells are smaller and paler in color than the normal. Ferritin levels हम करवाते हैं. This protein helps store iron in your body, and a low level of ferritin usually indicates a low levels of stored iron. Simple. When we talk about the iron binding capacity या transferrin levels, TIBCs जिसे हम कहते हैं अक्सर, transferrin is a protein that carries iron in your blood. Total iron binding capacity measures how much the transferrin in your body is not carrying iron. अगर ज़्यादा होगी इसका मतलब है कि वो bind नहीं कर रही. If you have iron deficiency anemia, you shall have a high levels of transferrin that has no iron. Stool complete examination. Again, very important. Testing stool for the presence of hemoglobin is useful establishing gastrointestinal tract bleeding as the etiology of iron deficiency anemia. Along with that, an ova and the parasite examination is a microscopic evaluation of a stool sample that is used to look for parasite that may infect the lower digestive tract, causing symptoms such as diarrhea, abdominal pain, discomfort. The parasites and their eggs are shed from the lower digestive tract into the stool. जैसे ये आए, deworm करें. Treatment. Iron deficiency anemia is usually treated in two ways, which involve increasing iron intake and treating any underlying conditions. Like I said earlier, अगर हुकवर्म इन्फेस्टेशन है तो उसको आपने डीवर्म करना ही करना, जो कि मैंने पहले भी बताया अपनी पिछली स्लाइड में, दैट इज़ वन ऑफ द मोस्ट टॉप लीडिंग कॉज एज फार एज दिस प्रॉब्लम इज कंसर्न। किसी का मेनोरेजिया है उसको ट्रीट करें, पोस्ट ट्रॉमेटिक है उसको मैनेज करें, जीआई ब्लीडिंग है उसको मैनेज करें बिकॉज ऑफ द अल्सर और एनी अदर प्रॉब्लम। Supplements are often available over the counter. It is important to take the supplement as prescribed. This is because too much iron can be toxic and damage the liver. Again, very important. So too much of supplementation is harmful as well. So we never go for self-medication. This is another take-home message for the people who are not linked with medical field. Furthermore, large amount of iron can cause constipation. As a result, a doctor may prescribe stool softener or laxative to ease the bowel movements. Take iron tablet on an empty stomach. Again, practical point. If possible, take your iron tablets when your stomach is empty. However, because iron tablets can upset your stomach, you may need to take your iron tablets with meals. Do not take iron with antacids. Medication that immediately relieve heartburn symptoms can interfere with the absorption of iron. Take iron 2 hours before or 4 hours after you take antacids. Take iron tablets with vitamin C. Why? Vitamin C improves the absorption of iron. Your doctor might recommend taking your iron tablets with a glass of orange juice or with vitamin C supplement. So we come across a lot of iron preparation with vitamin C as well. This is why we add on this vitamin along with the iron to make it absorption more. What are the dietary source of iron? When we talk about the dietary source, heme iron, which we can find in the liver, red meat, seafood, poultry, eggs वगैरह शामिल हैं. But when we talk about the non-heme iron, we can find it from the vegetables, that is beans, dark green leafy vegetables, spinach वगैरह, dried fruit, raisins and apricots, iron fortified breads, cereal, pastas, etc. Infants, important point. Do infants get enough iron from breast milk? अल्लाह सुब्हाना ताला ने हर तरीके से इंसान को बेस्ट बनाया, हर तरीके से हर इंसान के लिए बेस्ट किया. So most newborns have sufficient iron stored in their bodies for at least the first 4 to 6 months of life. According to American Academy of Pediatric Society, infants who only receive breast milk, which is called as exclusive breastfeeding, which should be done up to 6 months, especially this part of the world where we are living in Pakistan, will need a supplement of iron each day at a dose of 1 milligrams of iron for each kilogram of body weight. This supplement of iron should start at 4 to 6 months of age. Why? Because Allah subhanahu wa ta'ala has given us enough amount of iron and the stores which can survive up to 4 to 6 months of life. If an infant is receiving only iron fortified infant formula milk during time before complementary foods are given, means before 4 to 6 months, then additional iron supplementation is not necessary क्योंकि उसमें पहले से शामिल होगा. So what are the children friendly high iron foods? There are many: eggs, dried fruits, meat, oatmeal, dark chocolates, even peanut butter, pulses, nuts. So even salmon fish बच्चों को दी जा सकती है if they are not allergic to fish. So that contains iron as well. So mothers have to, especially parents have to look about what exactly they are giving to their kids. Now the possible side effects of iron supplements. हम बहुत सी दवाइयाँ लेते हैं, बहुत से side effects होते हैं. One of the common side effects, GIT disturbance, constipation, nausea, diarrhea, faintness, vomiting, dark stools because of the color, points to be considered while prescribing iron. Number one, अगर बच्चों में दे रहे हैं kids compliant, definitely flavor will be the utmost important factor. Side effects minimum ना हो तो बेहतर है, interaction minimum ना हो तो बेहतर है, absorption अच्छी होनी चाहिए, no gastrointestinal complications, could be used for longer period of time, having maximum bioavailability. So these are the possible practical features which should be considered before prescribing any iron supplementation. Prevention of iron deficiency. Iron supplementation definitely during the pregnancy औरत को अपने बच्चे के लिए ज़रूरत होगी. According to WHO, 60 milligrams elemental iron and 250 milligrams folic acid daily for 6 months and additional 3 months in postpartum period in low prevalence countries like Pakistan. Treatment of hookworm infestations, deworm करना है, important of dietary habits, iron rich foods दें, totally properly sanitization का ख्याल रखें, plus proper cooked food होना चाहिए to avoid the worms infestation. Types of iron supplements. Now we have a lot of ranges. Pharmacologically, we have the ferrous iron. This doctor recommend type include ferrous sulfate, ferrous fumarate, and the ferrous gluconate, which are bioavailable and have high concentrations of elemental iron. Be sure to select slow release tablets if this type of iron causes your GIT discomfort. Another type is the ferric iron. This form of iron needs to be broken down by the body to become bioavailable. Therefore, it is not an easily absorbed or as frequently recommended. However, if your stomach cannot tolerate ferrous iron, this type is easier on the stomach. Another type is the chelated iron, also available as iron bisglycinate. This type of iron is bound with amino acids to make it more bioavailable. It is effectively absorbed by the body as ferrous iron, but it does not typically cause gastrointestinal discomfort. So among these, it looks very smooth and very easy for the patient to tolerate as far as these three types are concerned. Carbonyl iron, rather than a mix of iron salt like the other iron supplement types, carbonyl iron consists entirely of microparticles of elemental iron. It dissolves slowly in the stomach and carries less risk of iron toxicity. Now we have a new choice here, which is the lysosomal iron, which is a new innovation, the most innovative iron source for functional foods and dietary supplements. है क्या? अगर आप इसकी डायग्रामेटिकली भी आप इसको देखें तो एक लाइसोमल लेयर है जो इसके ऊपर कवरिंग कर रही है. वो आपकी एब्जॉर्प्शन को बचाती है, स्टमक फ्रेंडली रहती है, जीआईटी सिम्टम्स को मिनिमाइज करती है और एट द एंड ऑफ द डे एब्जॉर्प्शन मैक्सिमम करवाती है from the gut. There was a study conducted. Liposomal iron is better than iron sulfate in correction of anemia of chronic inflammatory diseases of young women. इसका कंक्लूजन ये था कि lysosomal iron is more safe, effective, well tolerated, effective than iron sulfate in increase hemoglobin level and reduce inflammatory markers in correction of anemia of chronic inflammatory diseases of young women. That clearly shows that this type of the iron is much safer, much effective than the iron sulfate, which we usually prescribe. Oral liposomal iron a treatment proposal for anemia मेरा ख्याल है कि हम डिस्कस कर चुके हैं. I quickly summarize this slide that this is the best choice we have at present when we talk about the side effects of the iron supplementation are concerned. The liposomal protection allows the iron to overcome the free gastric environment, preventing degradation of substance. This is again a key point as far as this type is concerned. Liposomal iron provides double hemoglobin rise than the ferrous sulfate. Again, a study was conducted. You can very well you can see by yourself that 1.9 grams per deciliter as far as the liposomal group is concerned, as compared to the ferrous sulfate group, which was just 0.9 grams. It's not only about the GIT safety, it's the absorption as well. एब्जॉर्प्शन होगी तो आपका हीमोग्लोबिन लेवल भी बढ़ेगा, क्योंकि आयरन एब्जॉर्प्शन अच्छी होगी आयरन डेफिशिएंसी एनीमिया में, जिसने हीमोग्लोबिन लेवल को डिक्रीज किया हुआ है. सो वी शुड हैव दैट काइंड ऑफ ड्रग वी इन हैंड, जिसके साइड इफेक्ट्स भी कम हो और अलॉन्ग विद दैट उसका हीमोग्लोबिन इनहेंस करने का पावर भी ज़्यादा हो. थैंक यू वेरी मच. आई होप you people have not only learned or got the chance to discuss about the new salt which we have in the market with the name of Furfur Grow, but we have discussed about many practical points like worm infestation and many types of the iron supplementation, when to prescribe, how to prescribe. Thank you very much. If you have any query or any question, you please free to write down or jot down your question in the link below given by the website. Thank you very much. Assalamu alaikum.